10 unhealthiest states in the United States. The United States is one of the most health-conscious countries in the world, yet there are still differences among states when it comes to overall health. From obesity rates and access to healthcare to air quality and smoking habits, certain states have earned a reputation for being particularly unhealthy compared to others. This video will take a closer look at the top 10 unhealthiest states in America and explore why they rank so low on the list. We'll examine how each state stacks up when it comes to key metrics like number of deaths from preventable diseases, percentage of adults who don't exercise regularly, prevalence of mental illness, and more. By understanding what makes these particular states so unhealthy, we can better understand how other regions can improve their own health. 10. Indiana. Indiana is one of the unhealthiest states in the United States. According to a report released by America's Health Rankings, Indiana ranks 41st out of all 50 states for overall health and wellness. The state has low rankings for physical activity, access to preventative care services, and prevalence of obesity. In addition, Indiana also reports high rates of smoking and binge drinking among adults, as well as higher than average rates of diabetes and cardiovascular disease mortality. As a result, Hoosiers are more prone to chronic illnesses such as cancer or heart disease than residents in other parts of the country. Fortunately, there are many initiatives underway across the state that aim to improve public health outcomes through educational campaigns about healthy lifestyle choices and increased access to quality healthcare. 9. Tennessee. Tennessee is one of the unhealthiest states in the United States. According to a report from the Robert Wood Johnson Foundation, Tennessee has some of the highest rates of adult obesity and diabetes in the nation, as well as high rates of smoking and physical inactivity. As such, Tennesseans have higher mortality rates due to chronic diseases than those living in other states. Additionally, access to healthcare remains an issue for many residents who lack insurance or are underinsured. While there have been efforts made by various organizations to improve health outcomes for Tennesseans through public health initiatives and educational programs, more needs to be done if we want our state's population to become healthier and live longer lives. 8. Oklahoma. Oklahoma has been ranked as one of the unhealthiest states in the US. Many factors contribute to this ranking, such as high rates of obesity, smoking, and physical inactivity. In addition, Oklahoma also ranks low on access to healthcare and preventative care services. The state has a higher rate of uninsured residents than the national average and a lack of resources for those who need them most. This means that individuals may not receive the medical attention they need when they are sick or injured. With poor health outcomes and limited access to healthcare services, it is no surprise that Oklahoma is one of the unhealthiest states in America. 7. Louisiana. The state has a high obesity rate, with more than 35% of adults being obese. It also ranks as one of the worst in terms of physical activity and access to healthy food options. Louisiana also suffers from high rates of smoking and excessive drinking, which can lead to serious health issues like heart disease and cancer. Additionally, some areas have been hit hard by Hurricane Katrina, resulting in widespread mental health problems due to trauma caused by displacement. In order to improve its overall health status, Louisiana needs to invest in public health initiatives that address these underlying causes of poor health outcomes for its citizens. 6. New Mexico. New Mexico has been ranked as one of the unhealthiest states in the US. With a high obesity rate, limited access to healthcare and nutrition education, and low levels of physical activity, it's no wonder why New Mexicans have such poor health outcomes. The state also ranks among the highest for rates of smoking, diabetes, hypertension, and heart disease. Furthermore, many rural areas lack sufficient access to healthy foods, making it difficult for residents to make healthier food choices. Overall, there is much work needed to improve public health in New Mexico if its citizens are going to lead long and healthy lives. 5. Alabama. Alabama is one of the unhealthiest states in the nation. This can be attributed to a variety of factors, such as poor access to healthcare, high rates of poverty and food insecurity, lack of physical activity opportunities, and unhealthy dietary habits. Poor access to healthcare means that Alabamans are not able to get regular medical checkups or timely treatment for illnesses. High poverty levels mean that many families cannot afford healthy foods or leisure activities like sports teams or outdoor recreation facilities. Food insecurity affects nearly 1 in 6 Alabamans and contributes to higher obesity rates among children and adults alike. Finally, unhealthy dietary habits are common throughout Alabama due to an over-reliance on fast food restaurants and convenience stores for meals instead of preparing nutritious meals at home with fresh ingredients from local farmers' markets. All these factors contribute greatly to why Alabama is so unhealthy as a state. 4. Kentucky. Kentucky is one of the unhealthiest states in the nation due to a number of factors. Poor access to healthcare, low levels of physical activity, and high rates of smoking are all contributing to this problem. The state has some of the highest obesity rates in the country, as well as one of the lowest life expectancies for men. Additionally, Kentucky ranks poorly on measures such as mental health and substance abuse, with many residents facing issues related to addiction or poor mental health care. Furthermore, poverty is an issue that contributes significantly to unhealthy lifestyle choices and lack of access to nutritious food or medical services. All these problems have resulted in Kentucky being one of the least healthy states in America. 3. West Virginia. West Virginia is one of the least healthy states in the nation. This is due to a vast number of factors, such as limited access to healthcare and poverty. West Virginians have some of the lowest life expectancies in the United States and are more likely than those living elsewhere to suffer from chronic diseases like diabetes, heart disease, and cancer. Poor diets are also a factor. Many West Virginians lack access to fresh produce and lean proteins, which leads them to consume higher amounts of processed foods that contain unhealthy fats and sugars. Additionally, West Virginia has seen an increase in drug use over recent years, particularly opioids, leading to further health problems among its citizens. These issues all contribute significantly towards making West Virginia one of America's unhealthiest states. 2. Arkansas. Arkansas, being one of the unhealthiest states in the United States, is due to a combination of factors, including high rates of poverty, lack of access to healthcare and healthy foods, and limited opportunities for physical activity. Poverty limits access to healthy food options, leaving many unable to afford nutritious meals. Furthermore, there are large areas in Arkansas with limited or no access to healthcare services, which can lead to poor overall health outcomes for individuals who do not receive regular medical attention. Additionally, rural areas often lack safe walking paths or parks where residents can engage in physical activity. This further contributes to an unhealthy lifestyle. Finally, obesity rates are higher than average in Arkansas due mostly to poor diet choices coupled with a sedentary lifestyle that does not include enough exercise. All these factors contribute significantly towards making Arkansas one of the least healthy states nationwide. 1. Mississippi. Mississippi is one of the unhealthiest states in the United States. This is due to a combination of factors, including poverty, inadequate access to healthcare, and poor health education. Mississippi has an especially high rate of poverty, which can lead to many people not being able to afford healthy food or see medical professionals when needed. Additionally, there are few options for preventative care due to limited access to healthcare services throughout the state. Furthermore, health education is lacking as Mississippi ranks at the bottom for high school graduation rates and SAT scores, making it difficult for individuals to be informed about their own health risks and how they can improve their lifestyle choices. All these factors contribute significantly towards why Mississippi is so unhealthy as a state. Overall, the unhealthiest states in the United States are spread across different regions of the country. Although there are various factors that contribute to a state's health ranking, it is important for individuals to take responsibility for their own well-being and make healthy lifestyle choices. With proper nutrition, exercise, and preventative care, everyone can strive towards living a healthier life. Thank you for watching this video. Please don't forget to subscribe, comment, and turn on the notification bell.